Is my baby constipated or is it just infantile dyschezia or infant dyschezia? I think I've had this concern from many mothers, especially first-time moms and dads as well, wondering why does your baby have to be grunting, crying, and sometimes you can even see your baby turning red while they're trying to poop. But the diaper is still normal, there's nothing changed there. So let's talk about this condition that most parents haven't even heard about, infant dyschezia. So in today's video, what I want us to discuss more is how you can be able to differentiate between constipation and when it's infant dyschezia, and how to take the next action if you know what it is. And don't forget to share this with a parent who knows is struggling with their baby trying to poop and they're thinking, oh, my baby is constipated. Because I've seen so many women in the group writing almost all the time, why is my baby crying when they're about to poop? And is it constipation or is it something else? And what time should I actually go to the doctor for help? Before you reach out for that glycerin suppository or you try to give orange juice or water in your 2-month-old baby who's supposed to be exclusively breastfed, this video is for you, mom. This video is for you, dad, and also especially for you grandmothers who keep on telling the new time moms or the first time around moms that whatever they're doing is wrong. And in the past, you guys actually used to give water or you used to give pawpaw or orange juice and it worked for your kids. So listen up. So infant dyschezia is actually a normal and temporary condition, moms. It is where babies are struggling to coordinate with their abdominal and pelvic muscles while they are trying to poop. It leads to this strain or the grunting that you hear, reddening of the face and the crying, and a bit of irritability. It is not related to constipation and it should not be confused with constipation. So even when they struggle to poop, you realize when they're pooping, the poop is still soft and in the normal consistency as a baby who's being exclusively breastfed or a baby that has not yet started weaning. It is not to be confused with constipation because this is a condition that typically resolves on its own, usually by the time the baby is at 2 to 3 months. So you only notice it in the first newborn stages as they progress all the way to 3 months. Then after 3 months, you realize the baby no longer struggles when they have to poop. Of course, if they're struggling, then it should be investigated. It could actually be constipation. So number one, how do you be able to distinguish between constipation and infant dyschezia? As I've already told you, it's a temporary condition. With constipation, it progressively worsens and you'll realize it can even lead to surgical emergencies in case it leads to an obstruction. But with infant dyschezia, it's just because of the coordination, the struggle of coordinating the muscles, that the pelvic and abdominal muscles in a newborn, and that's why they struggle and get to cry and you see them straining while they're trying to poop, but their poop is still of the normal soft consistency, which comes to point number two. In a constipated baby, you're definitely going to notice that their poop is hard and firm, as opposed to a baby that is not constipated and is having infant dyschezia. Their poop is going to be of soft consistency, just as I've already explained earlier, as a baby who is usually breastfed. But a baby who is being breastfed exclusively, and you notice that the poop is hard and the poop is also firm, that could indicate that your baby is constipated and you need to be taking them to the hospital so we can evaluate further. Is it because of inadequate milk, or the baby is not feeding for one reason or another, or what are the factors that are leading to constipation of a 3-month-old baby? Okay. The other thing, the poop in infant dyschezia will not have any blood stain, but if the baby is constipated and the poop is hard and firm, you can find a bit of blood stain. There's some trauma that through the passage of the poop from the anal orifice that can lead to some tears, which can get the poop to be blood stained. But in infant dyschezia, you should not see any blood or blood staining in the stool. And if you do, please again take the baby to hospital. It could be intussusception, it could be an array of so many other things that are happening. and it will be good if the baby can be assessed from a hospital setup as opposed to you trying at home to observe. Blood in poop should be taken to a hospital, especially for such a young baby. Okay, so as I already told you earlier, it's when the baby is struggling to relax the anal sphincter and properly coordinate the muscle of contraction so that the poop can be able to go out. So what are the things that you expect to see in a baby who is under the age of 3 months and are going through infant dyschezia? They're straining, they're crying, they might turn red on the face while they're trying to poop or while they're pooping. There's a lot of grunting sometimes, could be a lot, which can be frightening. But if it's the time that your baby is pooping, you should not be worried. You shouldn't be worried because again, it's definitely infant dyschezia, and this thing is going to end. The episodes of grunting, how do I know that this is normal or it's now getting out of hand? It sometimes can last between 10 to 30 minutes. Within that time range, it's totally okay. You shouldn't panic. You try to soothe your baby and calm them, knowing that both of you are struggling with this particular phase, but it's definitely going to pass. And then another thing that I've already talked about it, how to differentiate between this and constipation. If the baby is struggling to poop, but then again they just poop soft, like soft consistency and not hard stool or poop, and it's not blood stained, then you know it's definitely infant dyschezia. And usually the baby poops very regularly as per the usual schedule. You'll find out that if your baby normally poops like 3 times a day, then they'll definitely be pooping as well 3 times a day or twice or once a day. But when it's in a constipated baby, even the frequency of pooping tends to have reduced. So when you see that the number of times of pooping for your baby have reduced, maybe you should consider thinking it could be constipation and not infant dyschezia. So for those who actually do have your pediatrician number, like on a speed dial or just a doctor on speed dial, and you're wondering, when should I think it might not be infant dyschezia, and what time should I actually call the doctor? Or if you don't have a number of a doctor you can call, when should I be going to the hospital because of this? When the stool are hard, I already told you, could be constipation, okay? When the baby has not pooped for more than 7+ days, or a maximum of 10 days, when the baby has not passed stool for like 10 days, please take this baby to the hospital or call your doctor. If there's any blood stain on that stool, is it mixed up, is it on top of the stool, whichever, you take the baby to the hospital or you ring your doctor. And if you're generally just concerned about your baby's health, so you could be seeing some signs of obstruction because secondary to the constipation, baby is not retaining feeds. Now they're vomiting after every feed. The abdomen is getting bigger, or the stomach is distending and it's getting firmer, and they're not passing gas, and they start to vomit as well. That should indicate that we have a problem, and you should not sleep or even sit with that baby as you're waiting to see. Do not see anything. You should be heading to your hospital, not even calling the doctor, because this is an emergency and the doctor needs to see the patient just right in front of them. Okay? You might ask yourself, what are some of the things that I can do perhaps to be able to help my baby with this condition they're having? There's nothing really you should do other than soothe your baby. There's no particular treatment that has been said to help with infant dyschezia. It usually resolves on its own. I've told you, for most children between the age of 2 to 3 months, this condition normally resolves itself. So you shouldn't worry yourself on what to do and what treatment you should be trying to institute at this point, because it's going to resolve all on its own. The thing you need to know, and now that I'm telling you, we normally just reassure you as a parent, as a mom, as a new dad,